Here to set you free. How you doing? I'm Leslie Marshall. Happy Tuesday. I'm happy because after today, I'm going to have a week and almost a half off. I need it. I deserve it. I'm taking it. I'm tired. I need a break. Anyway, a lot of people need a break. We're going through a very, very difficult time. Happy Tuesday. Welcome to the only true democracy and talk. And glad to have you. We have a great guest joining us later in the hour, but let's kick it and check what is written in those headlines. First off, how desperate would people be in an election? And you know what? A lot of people would say, if you know that couple where the wife is, the husband's accusing the wife of cheating, but he's the cheater, projecting that on her. Well, Republicans are kind of doing the same, maybe, because they keep saying that Democrats have been cheating, although they don't think we're cheating in the states they won. Well, Georgia's Secretary of State says that Senator Lindsey Graham implied that he should try to throw away ballots, and also tells of death threats that he and his wife have received. Take a listen.
You described to the Washington Post a conversation you had with Republican Senator Lindsey Graham on Friday. You came away with the impression that he essentially wanted you to look for ways to toss out mail-in ballots. What exactly did he say to you?
Well, he asked if the ballots could be matched back to the voters, and then I got the sense it implied that then you could throw those out. And he really would look at the counties with the highest frequent error of signatures. So that's the impression that I got. But we've got signature match in place. We have signature match when you request the ballot, absentee ballot, and then we have signature match when it comes in. And then with our new online absentee ballot portal, that has photo ID. And so we feel really confident that the election officials have done their job. And that's what they're charged to do, is do their job and make sure the signatures match.
I just want to be clear on this, Mr. Secretary. You say Senator Graham wanted you to find ways to get rid of legally cast ballots because CNN asked him about these allegations. He denied them. He says that's ridiculous. His words, that's ridiculous.
Well, it's just an implication that look hard and see how many ballots you could throw out. And I think that they were looking at that as part of a court case. And one actually was subsequently filed, wasn't it?
You also told the Washington Post, Mr. Secretary, that you and your wife have actually faced death threats over the election results. So this is you're quarantining right now after your wife tested positive for coronavirus. So how are you both doing? I assume you're still negative. Is that right?
I'm still negative. Yeah, there's some threats have come in, primarily through my wife's cell phone number. That's a little unsettling for her, obviously. The first ones came in just, more subtle, and then they got more graphic, and then they come in with some vulgarity also. And so, we always think I'm on this side of the aisle, obviously, and you always think that your side wears the white hats. But people are really upset about this. And at the end of the day, I understand how contentious it is. We're going to follow the process. We follow the law. The results will be what they are. I'm going to probably be disappointed because I was rooting for the Republicans to win, obviously. But I have a process. I have a law that I follow. Integrity in this office matters.
Yes, it does. That's Georgia's Secretary of State talking about Senator Lindsey Graham implying he should throw away actual ballots, talking about death threats he and his wife received her on her cell phone. And in addition to that, I want to commend him because he's being honest. He said, look, I'm a Republican. I want Republicans to win. I also like him admitting that he's getting it from his side, because as a liberal, I can't tell you the nasty stuff. I shouldn't, that I get on Twitter, Facebook, email, LinkedIn, Instagram from my own side. And it's even worse from the other. Let's rip another. Lots to talk about today, and we have more with regard to Lindsey Graham. A staffer for the Georgia Secretary of State that you just heard from, Brad Raffensperger, said today that he participated in a controversial phone call with Senator Lindsey Graham, and he said he's corroborating that he heard Graham ask if state officials could throw out ballots. So Senator Graham is saying it's hogwash. The Secretary of State, Brad Raffensperger, who you just heard, said it occurred. But now a staffer said they were on the call. The comments come from the staffer, Election Implementation Manager Gabriel Sterling, who corroborates Raffensperger's recent claims about the phone call with Graham. and that is one of Donald Trump's most outspoken allies, who did a complete 180, as Mark would say, don't say 360, complete turnaround from trashing Trump back in the day. Earlier this week, you heard just now the Raffensperger accused Graham of asking him to, quote, look hard and see how many ballots you could throw out. And he was referring to absentee ballots that skewed heavily in favor of President-elect Joe Biden. So what he was basically implying, inferring, and hinting at was, hey, throw out a few for Biden. Graham denied the claim. He said it was ridiculous, that he would try to pressure Raffensperger to throw out legally cast ballots. I'm sorry, but you have another guy that's on the call. If this had been opposite, Republicans would totally believe the first and certainly the second claim. Now, in a response to a question from CNN about the incident, Sterling said, quote, what I heard was basically discussions about absentee ballots and if there was a percentage of signatures that were not really truly matching, is there some point we could get to, we could say somebody went to a courtroom, could say, well, let's throw out all these ballots because we have no way of knowing because the ballots are separated. There is no physical ability for this office to do anything among those lines, Sterling continued, referring to throwing out absentee ballots that have already been deemed legal by local election officials. And he continued, if somebody wanted to go that route, they could go the court route. Let's rip another. While in some parts of the country, there are high rates of coronavirus infection, and we saw that this past spring and summer, now most of the country is experiencing a surge, and they're experiencing the worst of it right now. Yesterday, my husband came home early from work. I've mentioned before, he's an orthopedic surgeon, and 2 of his patients out of the 4 surgeries he was doing yesterday canceled because they were COVID positive. The hospital does test people because if they're not symptomatic, they could be spreading to the healthcare workers in the OR and throughout the hospital and other patients and family members who are in the hospital waiting in the waiting room. And that has not happened at all since this has occurred. Has he had patients with COVID? Absolutely. But to have 2 surgeries out of 4, 50% of surgeries in one day cancel as a result of COVID, that's just a tip of the iceberg that we are seeing. So by the numbers, most American counties, 58% of them actually, have seen the peak of their coronavirus infections this month. 76% have peaked at some point this past fall. Regionally, if you look at the breakdown, using a 7-day average of cases to smooth out daily variances in reporting, 97% of Midwestern counties' cases peaked this fall. 22% of the Northeast peaked in the spring. That was led by New York City, or the New York City metro area. Western and southern states had the largest shares of counties peak during the summer. And the details, just 34% of U.S. counties' peak caseloads came during the spring or summer waves. April had the most peaks in the spring, 83 counties. July led the summer, 300 counties. So much for that heat wave helping. Public interest ahead of Thanksgiving travel, new coronavirus cases in the U.S. have never been higher, and online interest in the pandemic has never been lower. That's according to data from Newswhip provided to Axios. Now, the novelty of the virus is long worn off, with half a year past since our lives were upended. But the health risks, they have not gone anywhere. By the numbers over the last 2 weeks, news articles about the pandemic have generated 75 million interactions on social media. That's likes, comments, and shares, according to that Newswhip data. And the last time it was that low, over a 2-week stretch, the beginning of March, when we all started this, even though it came to us in January or earlier. Online interest in the coronavirus has been associated mostly with how disruptive it's been to people's lives rather than how severe of a risk it posed. Interactions peaked as Americans entered lockdowns and adapted to working and learning from home, and it has declined since then, save for an uptick when cases surged in June. Now, even President Trump getting affected in October, that only led to a relatively modest bump in interest for COVID. Here's the big picture. Lower interest, not less media coverage, is responsible for the lower engagement. The number of news articles published about coronavirus are comparable to the level of coverage when cases spiked in the summer in June and July. The 174 interactions per article last week are the lowest they've ever been during this pandemic. Similarly, mentions of coronavirus or COVID-19, they have remained consistently high in cable news over the past 8 months, usually averaging 100 and 200 minutes of monthly coverage on each cable network. Most coverage comes from CNN. That's according to Stanford Cable News Analyzer. I'm Leslie Marshall. That's what's ripped from the headlines. When we come back, more from Ripped right after this.
If you're worried your friend may be struggling, remember, you don't have to be there to be there.
You could say, how are you, or get a fake tattoo. You could ask with an app if it works for you. You could write them a text or knit them a sweater. If you can't be together, you could write them a letter. Whatever gets you talking. Whatever gets you talking. You could chat on the game, kick off your flip-flops. You could ask on your couch while you binge watch. However you do it, you gotta ask a friend. And if they don't share, you can ask again. Whatever gets you talking. Whatever gets you talking.
Reach out to a friend about their mental health. Learn how you can help at seizetheawkward.org. Brought to you by the Ad Council, American Foundation for Suicide Prevention, and the JED Foundation.
I was in the middle of the Atlantic Ocean when it happened. There was a sudden jolt and our submarine crashed on the seafloor. We were in total darkness.
That's Dr. Dejana Figueroa, a marine biologist and STEM teacher, talking about a deep sea dive she'll never forget.
It's funny, when I was a kid, I was afraid of the ocean. And there I was, 2 miles below the surface. But as a scientist, you prepare for that. Using our training and a little creativity, we fixed the sub and finished our experiments. The dive was just too important. Every dive gives us glimpses at things few people ever get to see. Glowing creatures, fiery undersea volcanoes. When we got back to the surface, I kissed the ground and called my mom, of course. But you know what? I wouldn't trade that dive for anything.
Dr. Figueroa uses her passion for STEM to discover new things and make the world a better place. She can STEM, so can you. Check out She Can STEM for more stories and inspiration. A message from the Ad Council.
I'm Rick Smith, and this is Labor History in 2. On this day in labor history, the year was 1785. That was the day the General Society of Mechanics and Tradesmen of the City of New York was founded. 22 skilled craftsmen with the motto, "By hammer in hand, all arts do stand," met on Pine Street to form a benevolent organization that could provide culture, education, and social services to craftsmen and their families. 2 months later, founders met for their annual meeting. They represented many of the city's trades, including hatters, butchers, sailmakers, bolters, and comb makers. In his book, Chance Democratic, historian Sean Willits states, the General Society was intended to be a semi-political umbrella organization for all of the city's independent mechanics, to help oversee the trades and secure favorable legislation from local and national government. The group captured the ideal of mutuality and craft pride essential to artisan fraternities since the Middle Ages. The General Society opened one of the city's first free schools at a time when there were no public schools. It established a tuition-free Mechanics Institute, the General Society Library, and lecture series. The Mechanics Institute, founded in 1858, continues to provide free evening trades-related instruction. The library, established in 1820, is the second oldest library in New York City. It is also one of the few remaining membership-circulated libraries. Its collections and archives span 2 centuries. The General Society continues its tradition of public lectures in the form of the Labor, Literature, and Landmark series. More recently, it has added the Artesian Lecture series that features lectures by master artisans. The series also promotes the work and art of skilled craftsmen. The General Society has been at its current location at 20 West 44th Street since 1885.
We are back. I'm Leslie Marshall. Welcome back. And we continue with what's ripped from the headlines. The new number of people hospitalized with COVID-19 in the United States, it has reached, sadly, a record high of 73,014 yesterday. That's per the COVID tracking project. Governors in several states announced new restrictions to combat the wave of rapid COVID-19 spread, with fears that the numbers will continue to accelerate as people gather for the Thanksgiving holiday. I was just reading that Dr. Fauci said you can't have any more of the state by state. We need to have a unified approach to this pandemic. I agree wholeheartedly. We are 50 states, but we are one nation. We need to be united. And speaking of more governors, even Republicans like Governor Hogan in Maryland, are going to sit down and meet with Joe Biden in a Zoom call to discuss how he, as a president, as he is president-elect, and they as governors of their states can work together going forward. Look, this is not political. We know this. This is no laughing matter. There was a nurse online who talked about people dying on their deathbed from COVID-19, still in denial that they could get this, that it's real, and that it will be what kills them and takes them out, and they die alone. I mean, this is how sad that is. And we're going to play that clip coming up with our guest in the next segment. Thank you, Mark. The number of people, like I said, new record high, 73,014 as of yesterday. And there are fears that the numbers will continue to accelerate, especially as people gather for the Thanksgiving holiday. Listen, every Thanksgiving, my husband and I and my kids, we normally go to Florida. We'll go somewhere in Florida, and then we end up in Orlando where my in-laws live, and we spend time with them. But we just can't do that. My mother-in-law has Parkinson's. My father-in-law is 91. It's too dangerous. And to get on the plane and fly so far is very dangerous to them and possibly to us, our children. And we're not going to see my husband's family at Thanksgiving. We also are not going to see my family at Christmas. So what we're going to do instead is my husband, my two children, our dog, and I, over Thanksgiving, we're going to do some beach stuff where we're gonna jet ski and we're gonna snorkel, and we can do that here in Southern California. And for winter, we're gonna do the opposite. We're gonna do like some snow skiing and snowboarding, and try and find things that we can do. Maybe some charity and some volunteering over Thanksgiving and Christmas, help others. It's going to be different, and it's going to be hard. I have never not seen my mother for an entire year. And this December, just a few days before Christmas, it'll be exactly 1 year since I have not seen my own mom. And neither she nor I are getting any younger. I say this because, those of us on radio, television like myself, I'm not saying this because Joe Biden's going to be our president. I'm not saying this because I'm a Democrat. I'm not saying this because it's a Democratic agenda or philosophy. I'm saying this because I'm a human being just like you, and we happen to be Americans, and we should be Americans together. Please don't endanger your life, the life of your family, or the life of my family by not wearing a mask, not social distancing. If you're going to be traveling, we're going to be doing some traveling, and we're going to be self-quarantining for 2 weeks when we come back home after Thanksgiving. That's easier said than done for some people. If you can't do it, don't do the traveling. I work from home. My kids are also from home. And my husband, as a physician, he has a lot of quarantining that he does, and he is tested for COVID at least once a week, more so when he comes into contact with the COVID patients. So please, for your safety, let's get this in our rearview mirror, folks. We can do this. We've seen other countries do this, other countries that are back to normal. Don't you want to be back to normal? I don't know about you. I want my kids to go to school. Look, I love what I do for a living, and I love being able to do it from my house. I'm not going to lie. I don't miss the airport and the long flights and the crazy hours, but I miss working with my colleagues in person and having that chemistry, like with Outnumbered, for example, sitting on the couch with those wonderful ladies and gentlemen that I get to work with at the network. So please stay safe. California Governor Gavin Newsom pulled the emergency brake on the state's reopening yesterday, announcing widespread closures of indoor services in the states, like the gym where my husband is freaking. New Jersey Governor Phil Murphy in Jersey announced indoor gatherings will be limited to a maximum of 10 people. The state will cap outdoor gatherings at 150 starting next week. Michigan Governor Gretchen Whitmer announced a slate of restrictions that included halting in-person classes. Washington State Governor Jay Inslee announced new measures on social gatherings the same day. And last week, New Mexico banned in-person services for non-essential businesses. Maryland ordered restaurants to reduce indoor dining capacity to 50%. Oregon announced indoor restaurant dining must pause limits to social gatherings and no indoor dining. Governors of New York, Connecticut, Minnesota, and New Jersey have all enacted 10 p.m. curfews in recent days for bars, restaurants, and gyms. And I want to point out, those are all Democratic governors. 2 states where they're not, Ohio and Iowa, they're shutting down. And those are Republican governors as well. And I say that because I don't want you to think the blue wave, the closures is a blue wave. Iowa, like I said, becomes the latest state to issue some sort of mandate for face wearing masks, wearing face coverings in public. So the United States reported 148,532 new corona cases just yesterday. 581 people died from the virus just yesterday. That brings the total to 238,217 deaths since the start of the pandemic. And if you don't have it and it hasn't affected you or a friend or a loved one, it's easy to rattle off numbers, but have you ever looked at actually how many numbers those are? Those are human beings. Those are lives. Those are somebody's parents, sisters, brothers, friends, grandparents. Experts have warned of a particularly deadly winter this year. They weren't joking. The coronavirus pandemic is intersecting with the seasonal flu. And if you haven't got your flu shot, please get it. I got mine yesterday. I'm a little bit sore, a little bit tender. But please do it for you. Do it for your kids. Do it for my kids. Let's rip another. Dr. Anthony Fauci told the New York Times' Andrew Ross Sorkin that life could return to some degree of normality by fall 2021, but that's only if 75%, 3/4 of us here in the United States get vaccinated. He said, quote, "This is going to be a difficult task. We've got to do outreach. We've got to be transparent." Fauci also said the U.S. still needs to make available rapid at-home test kits that can be used daily. Only a third of Americans are willing to get the vaccine. Let's rip another. President-elect Joe Biden's senior White House staff will include several close longtime advisors. It will be a first step toward his promises of a diverse administration, as outgoing President Donald Trump continues to ignore and withhold information from the Biden transition team. Biden forged ahead today, announcing several key hires. Picks include Steve Ricchetti, a veteran of Democratic administrations. He served as chief of staff to then Vice President Biden. As a counselor, Mike Danielian, a longtime Biden strategist, senior advisor, former Congressional Black Caucus chair, Representative Cedric Richmond, I think is a great pick, as another senior advisor and director of the White House's Office of Public Engagement. Biden said that America faces great challenges and they bring diverse perspectives and a shared commitment to tackling these challenges and emerging on the other side a stronger, more united nation. The official transition has been held up by a Trump appointee at the General Services Administration, Emily Murphy, who has refused to acknowledge the win for Joe Biden, president-elect. I'm Leslie Marshall. That's what's written in the headlines. Coming up, our guest and more right after this.
If you miss Leslie on TV this week, catch up at lesliemarshallshow.com.
Hey, Dad, how do airplanes fly? What's in this box? Can I touch this? Where does sand come from? Is this tree good for climbing? What happens if I mix these two things together? How are babies made? What does this thing do?
Kids are curious about everything, including guns. Talking to them about gun safety in your home is a good first step, but you can do more. Always keep your guns locked, unloaded, and stored separately from ammunition. Storing your guns securely is the best way to prevent family fire, including unintentional shootings. For more information on safe gun storage and ways to keep your family safe, visit endfamilyfire.org. That's endfamilyfire.org.
What do we keep in the attic? What's this thing called? Can I ride my bike
You said you
backwards?
wanted me to do it before I go
Like
to
I
bed.
said, kids are curious. It's up to us to keep them safe. Brought to you by End Family Fire, Brady, and the Ad Council.
Wake up and text. Text and eat. Text and catch the bus. Text and miss your stop. Wait. Text and be late to work.
Okay.
Sorry, I'm late. Text and work. Text and pretend to work. Text and act surprised when someone calls you out for not working.
Who, me?
Text and meet up with a friend you haven't seen in forever.
Hi.
Text and complain that they're on their phone the whole time. Text and listen to them complain that you're on your phone the whole time.
Hello? Hello?
Text and whatever. But when you get behind the wheel, give your phone to a passenger. Put it in the glove box. Just don't text and drive.
Sure thing,
Visit
thank you.
StopTextsStopWrecks.org. A public service announcement brought to you by the National Highway Traffic Safety Administration and the Ad Council.
And I just have 30,000.
Top regulatory officials in
No
Trump's
problem.
government keep chanting the same one-word mantra: deregulate, deregulate, deregulate. Day after day, these agency bosses have been liberating greedy business interests to do their damnedest to us consumers, workers, the environment, and even to our chicken dinner. Yes, chicken. Instead of Kentucky
sounds like a
Fried or
plan.
tacos con pollo, they're serving up chicken a la avian leukosis. That's chicken infected with a virus that produces cancerous tumors and lesions on the birds. In July, the U.S.
sounds good.
Agriculture Department's
Mark.
Food Safety and Inspection Service rubber-stamped a demand by Tyson Foods and other multi-billion-dollar meat conglomerates to deregulate chicken processing rules so they can sell chickens diseased
great.
with
Thank you very
avian
much.
leukosis for human consumption. And
Yes,
no,
I can.
the
Hi.
huge
Hi,
brand
how are
name
you?
marketers
Great,
would not
thank
even
you.
be burdened by having to
Good to have
put
you
a
with
right
us.
to know label on the package so
Thanks,
we
good to be here.
consumers can
Appreciate
know
it.
what we're buying. As always, the industry line is, it's perfectly safe. Trust us. No. Their claim is that slaughterhouse line workers can simply cut out any tumors they see, then process the rest of the animal. There are two problems with this claim. First, avian leukosis can be a systemic disease passing through the blood, so slicing tumors doesn't necessarily eliminate the virus. Second, line workers don't have time to see tumors, much less remove them, since Trump's corporate-hugging regulators have also allowed poultry factories to speed up their processing lines to 175 birds per minute. This means each worker handles up to 3 chickens a second. As Lyndon Johnson used to say about such political hokum, they can't make chicken salad out of chicken shit. To learn more, go to Food and Water Watch, foodandwaterwatch.org.
Follow Leslie on Twitter. Just go to www.twitter.com/Leslie Marshall, and we'll be sure to share your tweets.
Hey there, I'm Leslie Marshall. Welcome or welcome back. We have Scott Wilkinson joining us in just a moment, CEO of AlphaVu. They specialize in advanced network science. Their technology empowers their clients with competitive intelligence, message control, and smart engagement. AlphaVu also has a new patent-pending technology designed to provide policymakers with the tools and knowledge to identify and combat misinformation with digital conversations. Their website is alphavu.com. That's ALPHAVU.com. On Twitter, follow them at AlphaVu, AlphaVu instead of VU, AlphaVu, but it's ALPHAVU. And Scott's handle, our guest today, is at SGWilk, SGWILK. Scott, thank you for joining us. Let's first listen to a little bit of audio. This is South Dakota's ER nurse, Jody Daring, telling CNN's Allison Camerata that her COVID-19 patients often don't want to believe that the virus is real, even as they have it, and sometimes they're dying from it. Take a listen.
Said that even now, that the hospital is being overrun with COVID patients. They come in, they're horribly ill, they're gasping for breath, and yet they don't believe they have COVID?
Yeah, I think the hardest thing to watch is that people are still looking for something else and they want a magic answer and they don't want to believe that COVID is real. And the reason I tweeted what I did is it wasn't one particular patient. It's just a culmination of so many people. And their last dying words are, this can't be happening. It's not real. And when they should be spending time FaceTiming their families, they're filled with anger and hatred, and it just made me really sad the other night. And I just can't believe that those are going to be their last thoughts and words.
Anger and hatred towards you?
I think it's just a belief that it's not real, and nursing happens to be on the receiving end of that. And that's okay. We can take that. That's what you're there for. It's just in the bigger picture when you try to reason with people of, can I call your family, your kids, your wife, your friend, your brother? And they say no, because I'm going to be fine. And you're watching their oxygen levels, maxed out on what we call vapotherm at 100%, and their oxygen level might be 75. That's not really that compatible with life. And we know where that's going to head. And it just makes you sad and mad and frustrated. And then you know that you're just going to come back and do it all over again. And that's kind of where that stemmed from.
How could it not make your own head explode? They're gasping for breath. Their oxygen levels are dropping. What do they think is wrong with them?
I think people look for anything. People want it to be influenza. They want it to be pneumonia. They want it to be, we've even had people say, well, I think maybe it might be lung cancer. Something so far-fetched. And the reality is, since day one, when COVID started in this area in March, you've kind of been able to say, if it walks like a duck and talks like a duck, it's a duck. Like, I hate to tell you that you have COVID, but that's what you have. Even after positive results come back, some people just don't believe it. Now, that's not everybody. We have a lot of patients who are very, very grateful for their care and very thankful for what you do. But unfortunately, that's not what I'm remembering right now. And as my nursing career, that's not what I want to be remembering for. I want to remember the saves and the happy situations. And what I was remembering chilling on the couch the other night with my dog was not that.
Of course not. Of course not. And it's just so mind-blowing to think that they would rather have lung cancer. They'd rather a diagnosis of lung cancer than of coronavirus. And so, you've said that it just, if I quote you from morning television, it's an effing horror movie that you live every day. And so what toll is this taking on you?
Yeah, hindsight, I didn't realize that this was going to go viral. I probably could have left the F-bomb out of there, but the reality is that's how you feel. And so it is like, it's just a movie where the credits never roll. You just do it all over again. And it's hard and sad because every hospital, every nurse, every doctor in this state is seeing the same things. These people get sick in the same way. You treat them in the same way. They die in the same way, and then you do it over again. And we're so thankful for the lessons we've learned along the way, and we're doing a good job of taking care of the people that come in. And we're managing our patient loads here right now. Sometimes it's day to day, sometimes it's hour to hour. But the reality is that right now, it's not getting better. You said just as you started the show, 50 to 60% positivity rate. Our entire state has 880,000 people. It doesn't take much to do the math on that for how many of us are sick.
Absolutely. That clip. Thank you for sitting with us. Sorry about the length there, Scott. Scott, that clip fully demonstrates how misinformation is so powerful, and that sometimes even death won't break the hold that misinformation can have on a person or on their mind, correct?
Absolutely. Misinformation is incredibly powerful, and it's the evil stepchild of human biology and modern technology. We as human beings are incredibly stubborn creatures, and all of us, regardless of our politics, right, left, or center, make decisions first on an emotional basis before our reason kicks in. We all do that. And the fact of the matter is, when you exacerbate that with modern technology, where you are constantly fed things that you're predisposed to believe, getting different information, better information, something that may change your mind is incredibly difficult.
There's information out there, if you look at politics, right, before the election and even continuing now after the election, a lot of misinformation. Would you say it's one of the most significant problems in our society today?
Oh, without a doubt. And I do think it's important to differentiate between disinformation and misinformation.
Please do.
Disinformation, of course, is intentional. It's when somebody puts out a piece of information that they know not to be true. When the president says he won the election, that is disinformation because he knows that's not true. Audio is misinformation, and that's very different because it is very genuinely, honestly held and believed to be true, even though it's not. And those are very different things. And what we really need to focus on is misinformation, because that's what causes harm in our communities. And when it comes to COVID, it's what causes potentially death.
Can we combat misinformation? I mean, we just saw with that clip that for some people, death doesn't even break the hold that it has on some people. So how do we combat that successfully?
Well, there's good news and there's bad news. The bad news is very difficult and nearly impossible to change somebody's mind if they have a firmly held and entrenched position that is based on misinformation. What we can do, not yet been exposed to misinformation, or who are not so firmly entrenched in it. And we have to do that. I say we fight information by doing what our parents taught us. Listen, be respectful, state the truth respectfully, and stick to it, and do it again. I often encourage, there's an incredible lack of trust. The public does not trust. They do tend to trust people they know or feel they know. And I say to people, if you are not sure of what the truth is, talk to your doctor, talk to your pastor. Find a neighbor who you know you disagree with and invite them over to grill a burger, put a burger on the grill. It's those types of stepping away from Facebook conversations where you have time to reflect and time to reason, fighting misinformation. And the other thing, and this is a long-term, not an easy solution, we have to do much better about educating people, especially about basic civics in this country. There's a shocking lack of understanding why, and that's something that we really need to address.
How can we spot misinformation specifically used in posts that relate to COVID-19? We're in a pandemic, and that people believing that you can inject bleach, or right now there's something out there with mouthwash. I think some people think if they drink it or if they just gargle, they're gonna. How can we spot that information relating to COVID-19?
Yeah, so there are three things. We've done some analysis on this and looking for word usage that accompanies misinformation. One thing that we see is that often misinformation is accompanied of money or economics, taxes. Essentially, people are accusing institutions or individuals of recommending safety procedures because they're trying to steal money or do something for their own. The second thing, a lot of COVID misinformation is accompanied with very negative attacks on elected officials. And the third thing, of course, there's a lot of anger that's tied to misinformation. So bad language, extreme negativity. Any combination of those three things greatly increases the chance that what you're looking at is misinformed and you should step away from.
We're going to take a break. When we come back, we're going to talk more about this. We're going to talk about COVID. We're going to talk about misinformation, and we're going to talk about responsible for decisions that can truly affect people's lives here in the United States. We'll be back with our guests. We'll be back with you right after this. I'm Leslie Marshall. Don't go away.
America, your children have an amazing superpower. They can help save lives by not having play dates. That's right. By replacing get-togethers with virtual play dates and video chats, they can help slow the evil spread of germs. And if your superheroes do go outside, make sure they continue their superhero wing by staying 6 feet away from others to protect everyone in America land. Find out more at coronavirus.gov. A message from the CDC and the Ad Council. America, your children have an amazing superpower. That's right. They can help save lives by simply washing their hands. Just 20 seconds of thorough hand washing after they've coughed or sneezed or been outside can help fight against the dastardly spread of germs. Armed with only soap and water and hands, your superhero can protect you, your family, and everyone out there in America land. Amazing! Find out more at coronavirus.gov. A message from the CDC and the Ad Council.
Welcome to Code WAC, your podcast on America's broken healthcare system and how Medicare for All could help. I'm your host, Brenda Gazzar. Today, We'll talk about the legal challenge to the Affordable Care Act, now being heard at the U.S. Supreme Court. Scott Nelson is an attorney at the litigation group of Public Citizen. He handles a wide range of cases on behalf of the public interest. I interviewed Scott about this important case just days before oral arguments began on November 10th for some background and context.
Right now, there's a line in the federal statutes that says everybody's required to buy insurance, and if you don't, you pay a tax penalty, and that is zero, which is equivalent to saying there's no longer an individual mandate. So what Texas said is, they're not really challenging the individual mandate. What they wanted was an excuse to say the individual mandate is no longer valid, and the whole rest of the ACA comes down with it.
And what does that include?
The expansion of the Medicaid program, the requirement that health insurance companies can't deny coverage for pre-existing conditions, the provision that says parents can keep their kids under their plans even after the kids have become adults for a few years, the provisions that allow these marketplaces where people can go and buy individual coverage. All that stuff, it's a 1,000-page long statute. They say it's all got to go.
Get the full Code WAC story on progressivevoices.com and on the PV app. Catch all our episodes by subscribing to Code WAC wherever you find your podcasts. This podcast is powered by Heal California, a nonprofit that uplifts the voices of those fighting for healthcare reform around the country. Until next time, stay healthy.
If you miss Leslie on TV this week, catch up at lesliemarshallshow.com.
We are back. Hey there. I'm Leslie Marshall. Welcome back. Scott Wilkinson, CEO of AlphaVu, is our guest. Their website, once again, is alphavu.com. That's ALPHAVU.com. Their Twitter handle is @AlphaVu, and Scott's Twitter handle is @SGWilk, SGWILK. Scott, thank you for holding. Welcome back. We were talking before the break about misinformation. It's continuing to spread after the election. We're talking about specifically misinformation with regard to COVID-19. Now we have two companies, Moderna and Pfizer, in a race with over a 90% effective rate for vaccines. They're apparently going to be distributed to the highest risk individuals and healthcare professionals. And by spring, hopefully, the entire general population here in the United States. But there are many polls out there that show between a third and half of Americans say they will not get this COVID vaccine once it's available. Do you think that number is that high when we're in a pandemic with regard to this virus? Do you think that we're seeing numbers like that in large part because of the misinformation surrounding vaccines and COVID-19 as well?
Yes, absolutely. And I can tell you consistently across the board in every corner of the country where we measure, misinformation around vaccinations is higher than any other public health topic. And that's consistently the case, and it has been for a long time. The strange thing is that vaccination rates in this country are actually pretty high. So what we don't know is whether something has changed and the public really in larger numbers will not accept the COVID-19 vaccine when it's available, or whether now that the election is over, now that some of the heat is calming down, people will have the opportunity to reflect and hopefully will accept the COVID vaccine in as high rates as they do other vaccines. We just don't know at this point.
You talked about before the break how we can spot misinformation, terminology that people use in their posts specifically related to COVID-19. How can America combat misinformation, or how can we fight the misinformation machine, if you will, to get Americans to realize that a COVID vaccine could help protect both them and our nation as a whole going forward?
Right. There are two types of misinformation around vaccinations that we see most commonly. First of all, is that claims of vaccines having certain side effects, certain very serious side effects. That is extremely rare. And if you have any concerns, you should ask your doctor. You should not take advice from social media. The second thing is that we see very commonly, particularly in regions much poorer demographics, for example, is people discussing the use of herbal remedies in lieu of a vaccine. And it's important to understand that it's absolutely no replacement. A vaccine is its own thing. And that's something we have to be very aggressive and very firm in our public information and outreach about.
I want to talk about the election, and there's a lot of misinformation. The U.S. Cybersecurity and Infrastructure Security Agency, which is part of the Trump administration, declared that the 2020 elections were the most secure in American history. And they went on to say there is no evidence that any voting system deleted or lost votes, changed votes, or was in any way compromised. Now, despite the clear statement from that agency that is housed within Trump's own administration, within his Department of Homeland Security, a post-election survey by Politico and Morning Consult found that 70% of Republicans say they don't believe the 2020 election was free and fair, and that's a stark rise from the 35% of GOP voters who held that a similar belief before the election. So why is there such a disconnect between what these voters think and what Trump's own Department of Homeland Security is saying about the integrity of our elections?
Unfortunately, this is one of the worst aspects of misinformation we see right now. And it gets back to that human biology aspect of, if I don't like you, I'm not going to believe what you say. If I do like you or I do support you, I choose to believe whatever you say. And the fact of the matter is, people who support the president or people who oppose the president need to look at the information on its own terms and not based on what the elected officials or candidates who they support say. Unfortunately, given the exacerbated problems in social media, confirmation bias, all of these problems together just really mean that there is a lack of appreciation and understanding of expertise and fact-based information. And it's alarming, and I'm afraid it's getting worse.
You're a tech guy. I am not a tech gal. But two companies, inside Silicon Valley here in the state where I live in California, have a lot of control over what goes out, two of which are Facebook and Twitter. And recently, they had separate and differing tactics to prevent misinformation. How would you evaluate Facebook and Twitter's attempts?
So I believe their attempts overall were well-intentioned and a step in the right direction. I think we also need to not be shy about understanding that these are private companies who operate for profit. And that's always going to be their primary motivation. The fact of the matter is there needs to be independent oversight and regulation that makes sure that the impact that these companies have on the public conversation is in the public good and for the public benefit. And that's not always going to be in line with their profit goals. So I applaud them for what they did, but it's only a first step.
We have probably not had this much before Donald Trump is president, but the president tweets a lot. The president has given out a lot of misinformation. What can be done when the misinformation is coming from the commander in chief? I mean, the president of the United States. When I was a kid, I was always, brought up to believe that, you listen to those in authority. We have bumper stickers that say question authority. And now we have to question the message coming from and the information coming from authority figures such as the president.
I think it's a great question, and it ties back to what the social media platforms themselves are doing. The fact of the matter is, Twitter, by its own admission, let the president get away with more than they would have if he were not the president of the United States, right? Because, and I understand this, you don't just shut off the social media account of the president of the United States. But the fact of the matter is that position is no longer sufficient. Social media companies are going to have to, and I think it's likely in coming years, will have some liability for the content that's on their platforms. And when that happens, they're going to be liable no matter the source of that content, whether it's the president of the United States or you or me. And I think that's the direction we need to go.
Speaking of the direction that we need to go, or just direction going forward, is this our new normal? I mean, the world of misinformation. Or when Donald Trump is no longer president, will some of that die down? I mean, between, the misinformation, the lies, the conspiracy theories, or is this our new normal?
I'm hopeful it's going to diminish to some extent, but it's not going away. And it's not going to go to where we were a few years ago. So in that regard, it is the new normal. But I absolutely believe there are steps that we can take, both on a personal individual level, to not participate in misinformation, to recognize it, to train ourselves to recognize it, and then on a regulatory perspective, to make sure that the social media platforms are doing what they need to do to diminish the impact of misinformation. If we take those steps the next couple of years, I think we can really be in a much better position than we have in the last 2 years.
Two questions with regard to youth. First of all, do you think the youth are better at recognizing misinformation than adults?
Yes, this is one of the really good news stories. I am incredibly impressed with the ability of younger people, regardless of where they are politically, to recognize when something is misinformed, when it's untrue, and to be able to share information to establish a common agreement on facts. I see it over and over. It's exciting. I think it's one of the things that we should all be very optimistic about.
Speaking of children, even younger children, what advice would you give parents or educators out there with regard to the misinformation? Children are largely learning remotely online. My children are, they're 12 and 13. And my son will sometimes say, my children will argue about things that they've read that are not true. And, obviously, if they didn't say it to me, I wouldn't be able to correct it. Any advice for parents or for teachers handling misinformation their children are exposed to?
Well, I'd say, first of all, the fact that that argument is happening is a really good thing, because that's that process of conflict and debate and discussion where truth gets revealed. The real danger is when kids are exposed to and reading information and they don't have an opportunity to discuss it. And then they just assume it's the truth and move on. So obviously having an opportunity to discuss with kids what it is they're seeing, what they think about it, and to also encourage them to go and look at multiple sources. That's really the best way to combat information and to discuss it with kids.
Should the government, in your opinion, Scott, have a role in combating this information or misinformation?
It's a tricky thing. Ultimately, yes. The fact of the matter is, we know that social media companies, their economic incentive is to allow and even promote outrage, because that's what gets clicks. That's what drives advertising dollars. A lie travels in social media 6 times faster than a fact. There's a lot of research out there about this. And so there is going to have to be a regulatory approach that promotes fact and discussion and free access to information over outrage and misinformation.
Last question. We have 60 seconds, so you have to make it quick. I think Pizzagate, or pedophilia Pizzagate, is an example where a man walked in with a gun and he couldn't, thankfully, pull the trigger. But misinformation can lead to someone's death. I'm not just talking about COVID. Absolutely, it can. Misinformation has exploded in frequency and intensity, and it is causing, it's impacting people's lives, and it's causing deaths, both in COVID and elsewhere. It's a very serious problem. I am optimistic that we are starting to get ahead of it, to understand it, and to be able to implement processes and regulations that'll help us combat it, but we have to stay on top of it. I want to say thank you because you educated me today. This is an area that I'm just learning more about. It's fascinating as a parent. It's worrying as a voter. It's frightening. And living in a pandemic, even more so. Scott, thank you. And thank you for your company and what they do at AlphaVu. Scott Wilkinson, CEO of AlphaVu. Once again, their website, alphavu.com. That's ALPHAVU.com. On Twitter, at AlphaVu. ALPHAVU, and Scott's handle is at SGWilk, SGWILK.